I'm pleased to welcome back to the program longtime friend of the show, Bill Scher, contributing editor to Politico Magazine. He's got an article from a week or two ago called The Single Payer Insanity. The Democrats' presidential contenders are rushing to embrace Bernie Sanders' Medicare for All plan. Have they learned nothing? The headline said. So, Bill, I've gotten some emails from people who are a little bummed out about this article, and they said you've got to figure out exactly where Bill is on this. Can you first just outline for the benefit of the audience, what is your personal view on single payer versus how does it relate to what you think is good strategy for Democrats?
Uh, I am strongly for universal coverage, and I'm policy agnostic how you get there.
Okay.
If I was president of the United States and the country was 80% for single payer and it flew through the Congress and landed on my desk, sure, I'd sign that. But that doesn't mean there aren't other ways to get to universal coverage. And now we're in a situation where we have had 3 decades of painful healthcare political fights.
Yep.
We had the Hillary Care fight in the 90s. We had the Obamacare fight in 2009, 2010. We had the Obamacare repeal fight this year. No one has come out unscathed for any of these fights, whether you're coming from the left or the right. From the Democratic perspective, Hillary Care didn't even happen, and you lost the Congress. Obamacare actually managed to get passed, but you still lost the Congress and arguably contributed to losing the presidency. And now Republicans try to yank it back, and now are they unable to do it? You literally have the president of the United States haranguing his own Senate Majority Leader and Speaker for failing to do it, which may well jeopardize their control of Congress if this leads to a loss of Republican turnout come 2018. James Carville had a quote earlier this year: "The mover on healthcare loses." There's no way to propose anything significant on healthcare without there being either real winners or losers substantively or perceived, and the losers are the ones that speak up the loudest and cause political damage to the politician making the move.
Yeah, but isn't there something to be said for the timing? I mean, on the one hand, you could say, hey, it's great that Bernie has now decided to propose Medicare for All 2017. There's no shot of that happening. You've got Republicans controlling the House, the Senate, and the White House, so it's a really easy political move. But what about the other side of that, which is now that there's not actually the possibility of it passing, is a time to start getting the idea of it into the public sort of discourse. As you point out in the article, it is something that generally speaking, more than half of the country supports. And even if you're not going to actually legislate it because it will never pass, isn't this a good time to start talking about it?
Here's the problem. I would, as a general matter, it is healthy to propose big ideas, shape the debate, try to move the center of political gravity your way, even if you don't get exactly what you lay out in the beginning. If you get half a loaf, a half is better than nothing. That's all generally true. What's different in this case is, so number one, Democrats have expended a lot of political capital to build the framework of the Affordable Care Act, which has gotten us 90% of the way to universal coverage. And there is a way to get to 100% with the existing framework. Now, mere proposing an idea, typically, there's not necessarily a cost that comes with that. There can be a political cost if you're proposing something that is manifestly unpopular, and therefore you will lose an election because of that. As you point out, and as other single-payer advocates point out, polling-wise, at least on the top line, the words single-payer generate over 50% support in some polls. Medicare for All, it's even a little bit better. It's more like 57%. People who are advocates can overstate the strength of those polls because there are other polls that bring up critiques that show those numbers can swing wildly once you get into the meat of the debate. But I'm not saying that if Democrats get behind this, they are surely to lose in 2018 or 2020. I can't prove that. What I do think is very risky and dangerous for Democrats is raising expectations to unrealistic levels. So if let's say Democrats win the Congress in 2018 and they win the presidency in 2020, there isn't a sense of strategic sensibility, I would argue, amongst most single payer advocates. Maybe some do. I generally hear from people, the people want this. Healthcare, there should be no profit in healthcare. There's no way to get to universal coverage with the Affordable Care Act. We have to do this. It's a moral imperative. If people have that level of expectation and they get a rude awakening come 2021, you're going to suffer what Republicans are suffering right now, which is recrimination. You promised us this. You said you're going to repeal Obamacare, and now you're telling me it's too complicated? Well, screw you. You just had a guy in Alabama, Luther Strange. He literally voted to repeal Obamacare, and he still got attacked because the Republicans couldn't get it done. Mitch McConnell couldn't get it done. You're close to him. It's your fault. That could easily be the case in 2021 if Democrats are saying, well, I said I was for single payer, but now I know it's too complicated. There's too many transition costs. There's too much disruption. I can't really do it. There's going to be a price to pay if that happens in 2021.
Well, I think that's true, but I think that the people who now are co-sponsoring Bernie's bill, just for example, are not the more sort of corporate centrist Democrats most likely to take that approach in a few years. But I want to think more about now, because you said something interesting, which is you've got this infrastructure of Obamacare, and you and I both know that if it weren't for significant obstruction from Republicans, there would actually be some pretty specific fixes that Republicans and Democrats could come together and do, and they would fix some of the problems within Obamacare, most of which are sort of, I believe, related to the fact that it just further ingrains the for-profit healthcare system and the problems within that. But you and I would agree there's fixes to Obamacare that could be made. Why not consider, rather than the debate being, repeal and replace Obamacare with Trump Care 3.0 or whichever version of the bill there is, or keep what we have now? Why not make the sort of range of ideas? Okay, well, Republicans want to repeal and replace and 32 million people will end up without coverage. Bernie and a number of other Democrats have co-sponsored Medicare for All 2017. Let's come to the middle and just make a few fixes to Obamacare. Like, wouldn't that in some way maybe make it more likely that the fixes to Obamacare get done?
I don't think so in this case. The way to get to, I mean, it's very hard to do anything in the current environment without bipartisanship.
Yep.
And as we know from the past, since Republicans took the Congress in 2010, that means doing very little. There's very little space of common ground to do. You certainly can't do big things with the way things are as it stands. Mm-hmm. The things that have gotten done because they went below the radar. They weren't above the radar. There are fixes that could be done that if they weren't interpreted as giving the other side a political victory, then maybe you could get them done. Once Republicans, and I think we're inching closer to the point where Republicans are going to have to admit, look, Affordable Care Act is law of the land. It is too enmeshed in the fabric of society now. You can't undo it without causing massive disruption. We have to accept it as it is, and now let's try to make it work as well as possible. Mm-hmm. If that's not going to happen, tomorrow. But the farther you get away from the Obama presidency, the farther you get away from the irrational spite Republicans have towards him, the closer you can get there. So I don't think having a fresh ideological battle over do you want government involvement in healthcare or not? I don't think that moves you naturally towards let's have some incremental bipartisan technical fixes. I mean, the things that should be done, quite frankly, are even not that simple. Let's increase the individual mandate penalty so people aren't being free riders. Let's find a way to empower the independent Medicare Advisory Payments Board so we have some more cost controls. Let's maybe there's a way to juice the subsidies for those who are applying for hardship exemptions right now. Those Republican governors in the more conservative states, maybe they can get over their spite and actually expand Medicaid. I don't think having the single payer argument automatically moves you there. And I think there's a whole host of other issues that are really on the sidelines: climate, infrastructure, the future of work, immigration. It's not like
and that's a good.
I'm glad you're mentioning
that. I'm glad you're mentioning that because that's one part of your article where you say, "quote There are more pressing issues to confront." I guess I don't understand why, if you say, "Hey, our position, or the position of this group of Democrats or whoever, is that we believe the ideal system is Medicare for all, and we will work within reason with Republicans to improve the system we have up until such point until Medicare for all is viable. Then confront all the other issues, right? It felt kind of like a nobody can walk and chew gum at the same time type of assertion.
Well, it's not that healthcare is not pressing. Obviously, if you don't have health insurance or your health insurance is insufficient, that is a pressing issue for you. Single payer is not a pressing policy goal because there are other means to get to universal coverage. I get a lot of people are dying. Well, if people are dying, take the fastest path to solving that problem, not the long, drawn-out, protracted ideological path if there's a lot of obvious obstacles that are going to be in your way. And there's a political argument to make, which is, look, Democrats can't run on wonkish technocratic policies. It was Mario Cuomo said, you campaign in poetry and you govern in prose. Well, don't go campaigning in prose. I get that. But campaigning on big ideas, comes with inherent difficulties. It's not like the farthest left candidate and the farthest right candidate win every election in which they participated. In many cases, they don't. So you got to pick your spots. And healthcare, we have 3 decades of evidence that is a very difficult spot to pick. It's not like Obama ran on healthcare as his signature policy plan in the general election.
No, but I think the one interesting aspect there is you mentioned, hey, listen, more than 90% of voters support requiring background checks for gun buyers, yet we ended up with a president who doesn't believe that. Isn't there every indication that people vote more on healthcare versus on gun control? In other words, recent Gallup poll, which looks at what are the most important votable issues for people, while people may have very strong opinions on gun control and background checks, healthcare always ranks much, much higher in terms of the most important issues in deciding on who to vote for. And thus, if you do find a position like healthcare for all, single pay or whatever, that is palatable to people, it might actually influence voting more significantly than the background check thing.
Well, I'm not arguing that gun control is somehow a magical political issue for Democrats to stand on. I did actually see a poll just this morning that was taken in August by, I think it was NBC Wall Street Journal, that actually said the opposite, that actually had guns at the top of the list.
Interesting.
Of things that would make you, would shape your voting decision. I mean, it wasn't 50%, it was 35%, but out of the list of issues, that was the number one.
Okay.
So it may just be how you word the question or what people's mood are on a particular day.
Yeah.
There's clearly a single payer movement. There's clearly people who, for that, it is their top issue. I don't think Bernie would make this his number one issue if that movement didn't exist. And there's clearly people on the conservative side who repealing Obamacare is their top thing. It's not like I can't make the case definitively that it's a bad political move in a campaign. I think as a policy matter, there are intrinsic policy complications in transitioning out of a system that has been built over time for 70 years. You're talking about, as a literal matter, I don't want to sound hyperbolic, but as a literal matter, this is a hostile government takeover of an existing industry. You can't come up with an historical example where that has happened in modern memory. So the insurance industry, by definition, are literally fighting for their lives. And you might say, well, good, they should. We don't want profit healthcare. Screw them. We should take them out. Evidence shows it's not that the insurance industry is going to buy off Congress people and you're going to lose, or they want to buy off Congress people and you can beat them with people power. Mm-hmm. It's that they're going to be well resourced. They're going to do their research. They're going to find the weak spots in your argument, and they're not going to be undercut by a divide in their ranks. We had in the Obamacare fight, the Obamacare process. Obama dealt with the insurance lobby, dealt with the drug lobby. The insurance lobby played kind of a double game, and in the end, they gave money to Chamber of Commerce to defeat it. But it wasn't like the 90s with Harry and Louise, those Harry and Louise, as in the 1993, they were issued before Bill and Hillary wrote the bill. That's how committed they were to defeating Clinton Care. That wasn't the case with Obamacare. And the drug lobby put in millions of dollars. They brought back the Harry and Louise actors from the 1993 ads and used them in pro-Obamacare ads. So the Chamber of Commerce campaign was neutralized by that. So there was a divide in the corporate community. You will not see that in a single payer front. You will face a unified front. I can't say this with certainty. I suspect that this insurance industry will go to other corporations and say, hey, if they can take us out, if you can have a hostile government takeover of our industry, they can do it to you too. So you better get on our side on this. That is just, I mean, you can't think of a more ambitious ask than to supplant a private industry with a single government entity.
Yeah.
So I just don't, and thinking through what that means politically, how do you answer people's questions over, for example, an obvious argument is, well, I'm going to raise your taxes, but you're going to have no premiums, you're going to have no copays, you're going to have no deductibles. That's a sweet deal. That's an easy argument. Once I articulate that properly, people are going to get it, and they're going to come on my side. But you did not see in Bernie's bill a provision that spells out what those taxes are.
No,
so
but that
down,
I don't know if that's.
Knows.
I mean, Bernie said that would be in a separate bill, and you can criticize that decision. You can criticize putting the spending part in a different, how you pay for it in a different bill, or you could say it makes sense to keep the appropriations part of it separate from the policy part. But that, I mean, there is a defense for that, which is, yes, it's not in that bill, but it will be discussed. But point taken nonetheless. I mean, I think you're right that there are a number of pretty big matzo balls that remain hanging out there that we sort of have to figure out.
He would not have gotten 16 Democratic co-sponsors, many of whom are potential presidential candidates, if that tax piece was in the bill, because he knows and they know that is hard to defend. And it's hard to defend because you can say it's going to be a sweet deal for you. Trust me that you're going to come out better at the end of the day. But there is some inherent distrust of government out there, whether we like it or not. And they're going to say, how do I know that you're telling me it's going to cover everything? You're telling me my costs aren't going to go up. But how do I know that's going to be the case 10 years after the bill passes? And if you're wrong, if you come back to me 10 years later and say, oh, I'm sorry, it's more expensive than I thought, well, where's my recourse? It's single payer. There is no other recourse. That's a lot to ask of people who, many of whom in surveys today say, I am content with my current health care. It may be that they're content because they haven't gotten into jam yet, but nevertheless, you have to get someone to say, you can't say if you like your plan, you can keep it. You have to say, trust me, this plan is better. That is hard politically to do. I mean, may it be hard politically in a campaign setting where you don't get all the details, but in a legislative setting, you will get into those details, and it is tough.
All right, Bill Scher, he said it all. I am getting ready I'll just start forwarding you emails later today, Bill. Bill Scher, contributing editor to Politico Magazine. Thanks for talking to us about this.
Always a pleasure.